Thank you. Mr. Page again.
Sorry, just changing tack now. Section 19 in the report. It says you undertook a study on oral health, and quoting you, you're currently working with internal and system partners on the recommendations. And that study was dated 2023, or that work was dated in this report in 2023. So forgive me, but that seems like quite a while ago. So in which case, considering that this area remains a leading cause in childhood hospital admissions, have I misread it in terms of the date and the actions that you've been undertaking? And if you have been following recommendations from that, what outcomes have we achieved for oral health?
Yeah, so we did do that. The Joint Student Needs Assessment, JSNA chapter back in 2023. You're right, there's probably more about what's in paragraph 20 as the response to that one, which includes our programs of work around oral health promotion, supervised toothbrushing, it being a sad fact of life that, you know, you get children in primary schools who don't know how to use a toothbrush, so it's a bit of a shame to some extent that we have to go in and do that, but that's certainly one of the things that we've stood up in there, as well as reminding dentists around the application of fluoride varnish in children as well, which is part of the dental contract. So I'd actually say, yeah, the JSNA has been done, and that's then led to the work that's been going on in paragraph 20. And you're right, actually, just to correct you, it's not one of the leading causes. Of course, dental tooth extraction is the leading cause of children's hospital stays, I think, isn't it? Number one.
Can I just ask a supplementary then to that? So in terms of measuring the effectiveness of those things, what metrics have we got to see that we're actually having an impact on the things that we're doing here?
That'll be our DMFT scores. So the score of whether you have decayed, missing or filled teeth, DMFT. For some years, or at least when we came over from the council, Leicestershire's DMFT score was not fantastic. Leicester City's, I think, was the worst in the country, and the counties wasn't far off. Over time, we have pulled ourselves up to be well out of the relegation zone. I'm hoping Adrian could tell me exactly where we are on that one. So I'd be the first to say, I don't think oral health in the county is, you know, we've got still space to go, but it's good to get out of the relegation zone into mid-table, if you like. Now, how much of that is the work of the small oral health promotion department? How much of that is societal changes or whatever? You could argue the toss, but I'd like to think we played our part.